So in FY21, we really rolled up our sleeves to bring new healthcare clinic locations to the Del Valley and Hornsby Bend communities. We did a lot of review of our data. We looked at the patients, we looked at the population of those communities and where they're headed, and we know that there's tremendous growth in those areas. We talked to the community, we had lots of community engagement, and we engaged a design team, and we are now concluding our design development for both new clinical sites. We're really excited about the opportunities that we're going to have to bring those sites to life in FY22. We want to make sure that these health and wellness sites include these services and programs that really look at the social determinants of health, that really improve and connect to health outcomes, and quite frankly, improve the quality of life for the residents of Del Valley and Hornsby Bend.
I don't think that anybody anticipated the breadth and depth of how COVID was going to affect our community, but Central Health quickly found its footing and its role in the disaster response in a couple of ways. Number one, and most critically, is as a funder of healthcare services. Second, our strong communications, engagement, and outreach efforts. And third, providing programmatic support to community care.
We are so excited to announce that our Customer Service Center launched in October of 2020. Our staff are now handling on average about 8,000 calls a month. Something that we're really proud of is that we have employed eligibility and enrollment specialists to answer our phones. And so when somebody calls, that eligibility and enrollment specialist can help them with whether it be initiating an application from start to finish, and or if they were just missing some information, completing the enrollment for them and mailing them a card that day. So when the pandemic hit, we really had to shift our services, and we quickly created an online application. So individuals now can apply online either at applyformap.net, or our Spanish version can be found at inscribaseamap.net. We currently are receiving on average about 2,000 applications that are submitted online to be enrolled in MAP and MAP Basic.
So for fiscal year 21, one of the strategic priorities around specialty care was really to focus on high need areas for our patients, with one of those being dialysis. Currently, our patients utilize dialysis through the ER, a term in which we call compassionate dialysis. So the new process that we're working to develop would consist of several components. It first would consist of access to consistent standard dialysis, usually 3 times a week for most patients. Also consists of vascular or catheter access, as well as case management and transportation services. As we know, going to dialysis 3 or more times a week can be a burden for some, so having that transportation access is key. The goal of the program is really to provide standard, consistent dialysis in conjunction with wraparound care.
So our medical management expansion really entailed expanding our teams to be able to reach out to more patients. We didn't have the capacity or the bandwidth to reach out to as many patients as we possibly could, and that also included reaching out to patients in local hospitals, patients within the community that needed our help. So what we did is we looked at some data and looked at how many patients we were able to case manage at one time, and then we determined the need for where we wanted our teams, along with how many teams we needed to expand. We also got really creative in developing the infrastructure to really meet the needs of our population. I think that was really a big piece of the medical management expansion this fiscal year, was really being able to target where our patients are, go to our patients, and be able to case manage them through the care continuum.